All right. This presentation is nutrition, physical therapy, and neuropathy with our presenters, Sue Gunning and Kara Kalous. I would like to introduce you to them, and then I'll turn the presentation over to them. Sue Gunning, MS, RDN, CSO, is a registered dietitian nutritionist at the Lemon Holton Cancer Pavilion. She specializes in adult oncology. She obtained her Master's of Science in Community Nutrition from Michigan State University, and she is a board-certified specialist in oncology nutrition. She and her husband have 3 boys and a rescue greyhound named Stu. Thank you, Sue. I'll go ahead and introduce Kara too. Kara's a physical therapist assistant with the Cancer Rehabilitation Program at Spectrum Health here in Grand Rapids. She graduated from Baker College of Muskegon with an associate's degree in applied science. Kara worked with the outpatient orthopedic patient population for many years before using her skill set in cancer care. Her role with the Cancer Rehabilitation Program includes working with all cancer types and helping to provide treatment to improve function and quality of life for patients as they go through their cancer journey. She also supports the cancer rehabilitation staff with program development. Outside of work, Kara and her husband enjoy coaching and watching their 2 daughters participate in sports, as well as spending time at their family cottage. So thank you so much, Sue and Kara. We are so pleased to have you with us today. Please go ahead and share what you have for us. Sue, if you could start.
Thank you. I appreciate that introduction. That was very kind. I'm going to go ahead and share my screen. Oops, I apologize. There you go. Sorry about that. I thought it was on the right slide. All right, so just as it was indicated, this is the talk for today. The first part is going to be talking about nutrition and neuropathy. And so I have the first couple of slides are a little busy, but hopefully it helps kind of solidify the following slides. So this is just looking at what the research says about neuropathy. And what we found, they had I found 4 specific research articles that dealt with nutrition and neuropathy. And they were specifically looking at supplementation. And so in this first one, they were talking about specifically taxane-based chemotherapies in breast cancer patients. And that you can see it was less than a quarter of them. So 15 to 23% of breast cancer patients is what they're looking at there. With this, they found that there's no U.S. Food and Drug Administration approved treatment options for neuropathy, specifically we're looking at nutrition or lifestyle changes. I'm sorry, supplementation rather, I misspoke, I'm sorry about that. But what we're actually looking at, oops, I apologize. My screen or my mouse is a little sensitive. So we did find certain lifestyle factors, which we'll dive into more, including obesity, limited fruit and vegetable intake, and also use of supplemental antioxidants have been linked. And we'll see this abbreviation throughout the presentation, the CIPN, which stands for chemotherapy-induced peripheral neuropathy. Can you guys hear me okay? I just noticed my screen froze. Can you see my slides okay? Okay, I'll keep on going. So the other research that I was referring to, the first one, and I have the references at the end of the presentation if you want to look for the studies yourself, and they are referred to in very small print at the bottom of the slide. But they looked at a double-blind randomized control study looking at a specific type of supplement called acetylcarnitine. And this is something that's used to break down toxins in the metabolic sense. And so that's why they chose this specific supplement. And they took it orally, again, looking at the taxane-based chemotherapy. And interestingly enough, when they looked at a placebo, which meaning that those that aren't getting the supplementation versus those that were, they actually experienced, the group that was getting the supplementation, more severe CIPN. And the only reason they chose the supplement, besides the they were looking for toxic metabolic byproducts, was that they had previously studied this in animals, which then after they found it safe for animals, then they start studies with humans. And so they had looked at it with diabetes and HIV. And so then that then moved it forward to this type of study. But you can see in this case, it was not beneficial. In another study it was called the Pathway Study, they looked at, again, this chemotherapy-induced peripheral neuropathy actually was 2 to 3 times greater when they were started in an antioxidant supplementation, again, looking at the specific type of chemotherapy, so this taxane-based chemotherapy. And so again, that wasn't a benefit. The third one was the small randomized double-blind, and they looked at, sought out women randomly assigned, given omega-3 fatty acids. And so this was a different type of chemotherapy, Paxatil chemotherapy. So they're given it 3 times throughout the chemotherapy and for a month after completion. Here, interestingly enough, they found that it had a significant decrease in the incidence of the neuropathy, but not a significant decrease in the severity. So just some things like food for thought to think about. Okay, so that's where this kind of gives me the rationale for the rest of this presentation and why we really want to focus on food as being the best way or best source for helping us with managing our neuropathy. And so we know inflammation and diet, we've seen a lot of correlation between that, and not just with cancer, but also other chronic diseases. And we also put in here the pandemic, as that also, we found that the Mediterranean diet, which is plant-based, can help us through that. And so when we say Mediterranean, what we are talking about are beans, legumes, salads, as it lists here, whole grains, fruits. We really want to limit our red meat consumption, usually no more than 18 ounces or less of red meat in a week is what is recommended. The other thing is found with the use of olive oil can be helpful in food preparation. Am I going too fast, or are you guys, is it okay? The speed okay?
Kara, Sue, I think your pacing is great.
Okay, good, thank you. So moving forward, so we talked about kind of the whole foods. Now we're going to talk about specific micronutrients. And so these micronutrients that are found in whole foods, we found for vitamin A, which is a fat soluble vitamin, is good for immune health. Well, as we know, that's one of the things we're concerned about, all of us, is staying healthy. And especially as we move out of the winter months, hopefully we're not still struggling with the cold and so forth. Also is good for skin and eyes, vitamin A. And that's for the color of the rainbow that we traditionally hear about, of being, you know, the darker in color, the more nutrient dense that it is, more phytochemicals or cancer fighters, that type of thing. So you just want to make sure that the types of things that you have, so like a sweet potato versus just a white potato, carrot, squash, which I know right now we're still in that transition of winter to spring to summer, so produce can be a little tricky, but we'll talk about that in a bit, of finding what is in season and how to work with that. So some ideas, just some simple recipes, so you don't have to feel like you have to make a lot of different things, but simple quick snacks, or even just a smaller meal prep So kale chips are easy to do. You can make them right in your oven, add some of the canola oil, olive oil, and that can, takes a matter of minutes to bake those up. Also, you could just try like a spinach dip with some sweet potatoes, carrots, or even some golden types of potatoes. Those also, again, giving your color, giving you more of those cancer fighters. One of the cautions when I mentioned before about vitamin A being a fat soluble vitamin versus a water soluble vitamin is it stays in our system longer because it's stored in our fat. And so we want to, often we think, probably more here in the States, that that more is better, and that's not necessarily the case. You just need to take in what is necessary. That's and not overuse, because especially with supplementation, sometimes people get too much, or in extreme cases, like I remember back when I was in school, they always, in our basic nutrition course, they always show the picture of the person that ate excessive amounts of carrots and ended up being orange. So like this last point here states, you can actually have an orange look to you from the carotenoids. So you just have to be careful. So again, getting that balance is what we're trying to get at, because again, it's a fat soluble vitamin. Vitamin C, I always, when you do have that common cold, I think often people use vitamin C or zinc or talk to us about that. But also, this can be found in food sources. We know that it helps with prevention of free radical damage, decrease inflammation, helps with the formation of antibodies. Also, again, to that second point, reducing respiratory illness length. So that's where cold symptoms can be abbreviated with the use of vitamin C. Some of the different sources: strawberries or blueberries, or deep colored peppers, citrus, your sweet grape tomatoes, broccoli, kiwi, cantaloupe. So to talk to the point of right now, I mean, we're getting more produce available. It's still like our colored peppers should still be palatable. Some of our, like I know for strawberries, blueberries, sometimes the flavor isn't there because we're in that transition. But typically, like broccoli, that should be pretty flavorful year round. So just working with that, or purchasing frozen versions of them, because they are picked at their peak, and so their nutrients are as rich as they can be. And then as we transition into the warmer months, then, going to the farmer's market and so forth, we'll be able to get some of the produce like we like to see, versus in the winter months, it's always a struggle. Citrus is at its peak in the winter months as far as what's in our grocery stores and so forth. So citrus is always fine to choose like fresh from your produce section. Some different ideas for recipes and how to apply this knowledge is if you had like a fajita and throw some of those colorful peppers on it. Because we like, or I know I'm a visual person, and so if it looks appealing, we're more likely to eat it. Also, taste is part of that too. And you can add a protein base. So in here, we're talking about like a seasoning of a teriyaki beef. You could also use chicken. That would be fine to do. Also, you could make a smoothie. So we'll give you this recipe on the next slide, but you can see just in less than 2 cups, so 15 ounces, you're getting over 1,000 milligrams of vitamin C. And the recommendation for vitamin C is 90 milligrams. So you're definitely meeting that. So here's that recipe we talked about, and just taking some orange juice, Greek yogurt. So that Greek yogurt's going to give you some protein. Your orange juice, banana, of course, fruits, giving you your fruits and antioxidants, strawberries. The frozen blueberries, excuse me, just to make it like it says, like a frosty, so it gives that coldness to it. And then spinach for color, but also another great antioxidant. And you can just blend it up. There's a lot of different versions of this, and I'm sure you guys probably could share your different takes on this and what has worked for you. I think just finding something that you and your family would enjoy doing, and make it part of your either daily, weekly, however you want to fit that in. Vitamin E is another fat soluble vitamin. So our fat soluble vitamins are A, D, E, and K. And so again, helps with fighting infection. When we think of vitamin E, we want to think about nuts. So your sunflower seeds, your almond seeds, your peanut butter, wheat germ, avocado. So that's not, but you can see our first ones were nuts, but then also avocado, olive oil, and salmon are all good sources. As far as a recipe to apply this, those different types of power balls with oats, and there's a plethora of different recipes with that. I think honestly, you could probably find 30 different ones if you Googled it or like went to recipes.com. They have a lot of different versions. And then, maybe with your friends or so forth, you've shared different ones. And I mean, you can make them with dried fruit. Some people will add honey just to help stick it to, the oats and stuff together to make that the ball essentially. And also the peanut butter would be in there. You can make a trail mix, and that's always fun to do because again, you can adapt it to what works best for you and your family. And just get a variety. Like maybe you want to throw some coconut in there on top of the different types of nut or seeds rather, dried fruit. So you can really, the sky's the limit on what you want to put in there and what's available. I know that's been a common thing too when talking to patients and being out in the community. Sometimes you go to the grocery store and there's sections of food items that aren't readily available. So maybe the dried fruit, the only thing available is mango, where 2 years ago you tended to find things fully stocked. So I know we're working amongst that too. So I think just being flexible with your recipes and yeah, just like with everything, we just need to be flexible right now. Vitamin D, like we said, is another fat soluble, also very important for our immune system. During the winter months, so between like November and April, we can be vitamin D deficient, and that how the sun and the earth, how we're rotated, we're not getting the same type of sunlight. And also being where we are in Michigan, we just could be deficient. So that's when you could have your primary care physician check blood work to see, and specifically for vitamin D3, to see if you're deficient. If you are deficient, then you may have to do higher levels. Otherwise, if you are fairly competent, if you're doing at least 1,000 to 2,000 international units per day during those winter months, that should probably be adequate supplementation to make up for the deficit of the sunlight that we don't have during this time. Although we're getting close, we're almost out of March and heading into April here soon. Some of the food sources include salmon, tuna, egg yolks, mushrooms, and then any of your vitamin D fortified dairy products. Zinc, remember we talked about that with vitamin C before. They work really well together for fighting a common cold. And it isn't too often that we see deficiencies, but it can occur. If you are going to use it just as to fight off like respiratory infection, common cold, that type of thing, you don't want to take this micronutrient long term. So like maybe 10 days up to 2 weeks. And then after that point, you would want to stop taking zinc. And the rationale behind that is long-term zinc usage can actually cause a copper deficiency. And so it's not recommended to take it for a lengthy period of time. So if you're supplementing in that case, if you're getting it through food sources, that's totally different. We metabolize it differently. So food sources are encouraged. So if you're getting it like through beans, legumes, as we list here, hummus, almonds, you can see the different food sources that are listed. And then we get the common question about probiotics. Are these good? Should I get them through my food? what's the best way. We do always recommend food sources, and that just the benefits. So using our gut, like it says here, 80% of our immune system is in the gut. And so some of the different food sources we commonly think of are like yogurt or kefir, which kefir is just truly like a liquefied yogurt. Sauerkraut, I know that's not super popular, but maybe that might be something to consider, or pickles. That might be something too that's to your liking. But truly, you can make different yogurt parfaits or smoothies, kind of make it fun. Again, add in those different fruits, any, oats, all the different things to kind of give it that different mouth feel that's good for you and your family. And you can see too, so having the whole grain lentils, doing beans and legumes, that also can help with our gut health. So really, we want you to look at real food, and that we don't really understand. I mean, we're knowing more and more, but there's so many complex pathways and just how foods work together. So that's sort of that synergy that we're talking about of combining foods. So then you're going to get more of the carotenoids, flavonoids, vitamins, minerals, phytochemicals just by eating a rainbow. Essentially, all those different colors can really help. And just how, like in this second statement, how olive oil and salad actually can help with absorption of the carotenoids. So those different things, how they work together. So really, getting that wide variety, understanding that we do have impact of sometimes limitations of products that are available to us. So then if you can, buy frozen fruits or vegetables, or, during the months when produce is readily available, you can freeze some and have it for those months when it's more of a challenge. Also, as you said, like preparing foods and freezing them, that's always a nice thing too, for later use. If you're concerned about portions, like as far as if if there's just two of you or just a smaller family, sometimes I've heard patients or people state that, it's hard to cook for one or two. So make those larger portions, then divide it up, freeze it, and you can pull it out for later too. That's always a nice thing. If you are, or if it is recommended that you take a supplement, so like for instance, vitamin D3, if it is found that you have a deficiency, what we're looking for is that it does have this USP seal, meaning that it's pharmaceutical grade. Because in the US, supplements are not regulated. You just want to make sure it has that seal on it, so that it indicates what is actually in the supplement is there. It's been tested and verified. And to go back to that eat seasonally, there's actually this nice website here to help you, and you can kind of see when it's at its peak. So I just threw that on there because really, like it states, getting variation in your diet, the taste, as you know, I know a strawberry that you purchase now, say from Costco, is not going to taste the same from your local garden, whether it be the local farmer down the street or if you are able to grow your own strawberries. It's just the taste is so different, right? They appear the same, they're both red, but the flavorful, the flavor of it is much more rich when it's season or in season. And as we said, supporting the local economy is always really important. This just kind of reviews what was talked about, but also to highlight, we do have a culinary medicine program or group here at Spectrum. And I'm actually going to go to the next slide. If you are interested, they have classes. So if you're like, I could just use a refresher or some new ideas for cooking plant-based, this is a way to connect with them. So it has both their website as well as email, and you can sign up for different classes. Currently, they're all virtual, but they're hoping in the near future, we have a site downtown in Grand Rapids that they'll able be able to have people come back downtown and do hands-on cooking classes. So hopefully in the near future that will be available. And we also have a series called Eating the Mediterranean Way. And the next class series starts April 25th. There, if you can see right here, they have one currently underway, and then the next one starts April 25th. Again, it's virtual at this point, but oops, goodness, I keep on doing that. Sorry about that. But you can kind of see it's an hour commitment on Mondays, but then it has a breakdown of the different topics that they talk about each week. So it's then helping you apply that plant-based diet into your life and just give you extra support. So these are my references. And I am, if anyone has any questions.
Thank you so much, Sue. Would you like to take it off the screen share and then we can
Oh, sorry.
That to the room?
Thank you for the reminder.
It's a little bit easier to ask the questions when we can see each other's faces, right?
That makes sense. Sorry about that.
Well, and as folks are thinking here, a couple of questions just came to my mind, Sue. I am wondering, since many of us here on this presentation today are dealing with neuropathy, is there some kind of a nutrient that's very important to have or something specific to that? And my second question is, I noticed that you mentioned legumes and dairy, and sometimes people have sensitivity to that, and just wondering if there's anything that can be done about that so they can still enjoy those foods.
Sure. Those are great questions. There isn't, I wouldn't say, a specific nutrient for neuropathy. We really want people to get a wide variety. So, if you can, and again, understanding some of it is seasonal, but if, you can get trying the different recipes, like if you did a fajita with the peppers, if you could do that. If you do have some sensitivities to dairy or whatnot, there's differing degrees. And you could always meet with a dietitian, like if there's more layers, I guess, to what your needs are. We do have both one-on-one and virtual counseling where we could dive into things deeper and come up with an individual plan for you. And so I think it just depends what guidance you needed. But yeah, there are, if you can't tolerate dairy, it depends if it's a lactose deficiency, or, I guess we'd have to dive more into that. And then as far as for, if there's a nut allergy, obviously we wouldn't want you partaking in nuts, or if you had celiac disease with gluten, there's definitely things that we could help you with. And so I think that's where maybe meeting one-on-one with a dietitian and getting more individual counseling might be beneficial in that case.
Well, thank you for that, Sue.
Yeah, you're welcome.
Anyone else, do you have questions?
Don't you have any questions? Don't you have any questions? God, I eat so good.
Thank you. Thank you, Sylvia. And Sue, what great information. Thank you for that. It's a lot to take in, but so interesting, and just remembering that rainbow of food and high in nutritional. And it really tastes wonderful, but not necessarily what we're used to eating. Yeah.
Thank you.
Thank you. All right, let's go ahead then and let Kara share.
Hi, everybody. Can you hear me okay?
Yes.
Okay, let me share my screen with you. Now that Sue made us all hungry.
I know, right?
I want some yummy strawberries and I need some vitamin D, so I'll go to Florida. Sounds like a good idea. All right, as you can see, I'm starting my slideshow here about physical therapy and how it's related to the chemotherapy-induced peripheral neuropathy.
There's so many neuropathies. Huh? There's 5 different neuropathies to talk about.
So some of it will be a little bit of a repeat of what Sue said, just kind of about what it is. We want to talk a little bit about what causes it and what it feels like, so we know why we're going to do what we can do about it. With physical therapy, we really talk about how it affects your daily function and then what we can do to try to keep that as good as possible. So when we talk about what it is, it's when chemotherapy drugs damage nerves, and there's different kinds of nerves. It attacks the peripheral nerves, which is why it gives it its name, the chemo-induced peripheral neuropathy. So it's affecting the system that you see over here on this side, and you can see where all of those nerves go throughout the body to the outer parts of it, or the periphery, thus giving it its name. But why does it happen? And this is what Sue talked about a little bit, but the cancer treatments, they're meant to kill the cancer cells, but unfortunately, the good cells and everything else, because it's so toxic, are also damaged. And this can be nerve damage as well, which starts to help in the aid of the development of CIPN. It can come from just one chemotherapy treatment, or multiple chemotherapy treatments, but there are some common drug culprits. So you may notice some of these names of drugs that maybe you yourself or someone you know has had to have for a diagnosis. And it's kind of, the taxanes is the one that with the breast cancer that Sue kind of pointed out, but there's a lot of other ones that are used too. As you can see, have a high percentage in being culprits and making this neuropathy happen. So unfortunately, with one of our very common treatments that we use, we also have a very common side effect of the peripheral neuropathy. So who's at risk? You know, just because you are having chemotherapy doesn't mean you're going to get it. The percentage you can see in the previous slide was kind of high, but there's different things to take in consideration of whether you might get it or if it may be more severe than somebody else. It's quite a long list there. I don't have to read it to you because you can kind of read, but on the list there is the vitamin and mineral deficiency. So it goes back to what Sue was saying, how nutrition is very important. So, you know, having a low weight, being younger, eating very well, not having any kind of other treatments before can all benefit you, but it doesn't mean that you're not going to get neuropathy either. But these are also some things, or risk factors that if you have them can make it worse. So when do you get it? It can start anytime after treatment. Some people will have it start right away. Some people finish their treatment and they start to feel it. But it's usually at the beginning and it slowly worsens over time as you have concurrent treatments and that kind of stack on top of each other. And the big question, right? Will it go away? Is it going to get better? Maybe. How's that for a terrible answer? We don't really know. We can't say, yes, it's going to go away. It can, but sometimes it actually doesn't. Sometimes it can stay. Sometimes it gets a little bit better, but doesn't go all the way away. And the only way to know is wait and see. That's the clock there. It's time, which can be very frustrating, especially if it's causing some problem with daily life or your function. Usually though, if you start to see it improving, it's a good sign that as the longer you get from your treatment, that it will hopefully continue to improve. So if you've experienced this or know somebody with it, you've probably heard these things or have heard that that's what it feels like or that it's doing to you, the symptoms that come from it. Obviously, it can be very painful, but I've had also some people that have no pain at all, but they have numbness where they can't feel anything. Both can be a very big problem. When you can't feel things that need to be touched or be able to sense cold or heat, or actually be extra sensitive to the cold or heat. Sometimes it's a tingling or burning sensation. When you don't have all your feeling, then balance can be an issue. You start to feel off balance or not safe maybe when you're walking or holding items with your hands. It can also result in some weakness or cramping of the muscles because the nerves aren't working right to control them, and sometimes trouble walking due to the things that you see on the screen. So if you hear of somebody who has maybe some tingling in one hand, it could be from something else. Very often, I don't dare say 100%, but most often, it's going to be either both hands or both feet that are involved, or all four. So it can be just the hands or just the feet, but it is going to be both sides. I have someone that was very close to me actually that she said her her hand was tingling. And I said, one hand? And she said, yeah, but the doctor says that's neuropathy. It was not. Unfortunately, it was not neuropathy. It was symptoms coming from the brain, from a tumor in the brain. So it's not something to scare you, but really pay attention to what the symptoms are presenting like, because usually, more often than not, it would be both sides, what they call bilateral, and not just one or the other. So they call it the glove and stocking distribution when the symptoms are in those areas, for obvious reasons. You can kind of see right there. One thing I'll say too is some people will get it just in the fingertips or just in the toes. The worst case, as it worsens, or if you have a worse case than somebody else, the more severe it gets, it tends to travel. So people who have like maybe numbness or tingling or pain all the way up to their knees or into their forearm is considered a more severe case than just in the fingertips. Some things you've probably said yourself if you have had neuropathy or know what it feels like. So I have some people too that are like, I want to get my sock off, but then it still feels like I have a sock on. So it's kind of hard to manage those symptoms sometimes. And you can see where it might affect wanting to walk. You know, if your feet hurt, you don't want to get on them, or if you're walking or have lack of feeling, that your balance can be off, and then it can affect the safety. So it's not something you really need to know, like what grade of CIPN do you have, but just that there are different severity and different levels of it. So, you know, if it's just a reported symptoms, it doesn't mean that it's not important or doesn't need treatment or to be shared with your provider. If you are having some symptoms, that's one thing that I'll touch on later too, is communication is so important, so that they can watch those symptoms with you and monitor them. There are things that can be done. Sometimes they'll take a holiday, they call it, from your chemo if that is medically safe to do so, just to give the body a little bit of a break. Sometimes they'll change dosage or delivery, or they change the chemo drugs if it's possible, to kind of keep that in check. So just because you're starting to feel a little bit, make sure you are not passing it off and letting your doctor know. Obviously, the more severe it gets, the more it can affect our function. So what do we do? And I don't mean this to be discouraging, but there's not really a way to fix the nerve. That is what's happened by the drugs. So really treatment is focused on relieving and managing the symptoms that have come from having the chemotherapy treatment. So there are different ways, though, to find some relief, as you can see right there. And I will just kind of point out those dietary supplements again that Sue just talked to us about. I just had a patient recently that cut out caffeine and had a really big change in his symptoms for the better. He couldn't believe what a big difference that made. I mentioned already maybe a chemo dose reduction or a holiday where they stop. But there are also other types of therapy. You may hear, if you would read research or things that can be done for the nerves, you might hear about a TENS unit. It doesn't have a lot of good therapy. It is basically a pain blocker, a little unit that you can get. Some people say it helped, other people say it doesn't. It's not something that we use in the physical therapy world to treat it. And if we move down, occupational physical therapy, I put it, of course, in blue with a happy face because it is a very good thing that can help. We'll talk more about what we do. But massage can help too. I'm just trying to keep those nerve endings healthy and responding to touch. So massage is good. Massage helps increase blood flow to the hands and feet too. So I know a lot of people, when it's tingling or sore, they'll sit and rub their feet or rub their hands, which is great. Exercise. I can't emphasize that enough. It gets hard because if your feet hurt or your hands hurt and you don't want to walk, you don't want to move around or touch things or hold things, or going for a walk does not sound good when your feet are hurting. Sometimes it can actually feel like your feet hurt worse after going for a walk. But using the muscles and getting the blood flow to the body is so important to help those nerves. That if you stop and the more you sit, the more the pain can actually intensify or be persistent. So sometimes that's a hard sell, trying to get people to move around or take that walk when you hurt, but it's very, very important. Some good things to do too is just the guided imagery, meditation, relaxation. It's really just distraction techniques. How often, if you're focused on something, does it seem really bad? But if you can read a book or watch a movie or have a conversation with a friend, whatever it might be, that can help distract you instead of focusing on it and can actually bring that pain down. Our brain is a very powerful tool that way. Acupuncture is one of those ancillary services that we also have. It's in the community, but we have it at Lemon Holton as well. I've heard it work really well for some people and not as well for others. I think that's one of those that you kind of have to see if that works for you, because it is different for everybody. So we'll talk a little bit more about rehab or the physical therapy role. Like I said, it can the CIPN can have a really big impact on our function because of what it does to us physically. So some of the things that you might find is that you have difficulty with performing your ADLs, those activities of daily living. If your hands are sore, even just trying to get dressed, buttoning buttons, or trying to do your hair or hold the toothbrush. Those things might be hard to do. Even getting upstairs or in and out of the car, trying to stand on your feet. Sometimes if you have the increased weakness or balance, that's definitely something that we want to get on top of so that we can prevent any accidents or falls, or you not being able to complete the activities that you'd like to because you're weak. Along with that comes the gait changes. If you don't feel everything that you normally feel with your feet, you may change your gait to be safer, and where that might feel like it helps, it can also cause stumbling and possibly falls. Sleep disruption. So if you're really painful, sometimes the sheets are even sore on your feet. So if we can get the pain or the symptoms managed, we can get you sleeping a little bit better, then you have some less fatigue. We want to keep your quality of life as good as possible when something like this kind of comes from the treatment that you've had to have. So that's our goals with the rehab, is to reduce the symptoms or the impairments that may come from having symptoms from the CIPN. We want to improve your function so that you can continue to do your daily tasks where you don't have to maybe depend on others for help and not have to have many changes to your life if possible. We want you to be able to keep participating in the things that you want to be able to do, but in a safe way too, so that you keep your quality of life. So some things that we would do specifically in physical therapy is, like, if we can't fix the nerves, what are we going to do? We're going to strengthen. We can try to keep those nerves doing their job by training them. So when we make muscles fire, they have less chance of getting weak or the nerves stop doing their job to make them work, to make the muscles work. So we do a lot of strengthening. and balance training as well. So keeping that brain and nerve connection to our writing reflexes to keep us upright, that can continue to be treated with some balance training so that we can eliminate hopefully the chances of having some falls or accidents. That goes along with the gait training as well, teaching you, how to walk, what senses to use when you don't have all the feeling in your feet. Maybe advice with some footwear or assistive devices to walk with. Maybe it's in use of a walker so that you're safe, but can still continue to be out in the community. We at Lemon Holton have a machine, what we call a Lympha Touch. It's something that we use. I mentioned that we don't use TENS, but we do use a Lympha Touch machine. It's very popular with the lymphedema population as well. It's kind of a suctioning machine, kind of like cupping, if you ever heard of the cupping or seen the circles on the Olympic athletes. They had the cupping done. It's not that intense. It won't leave circles on you, but it's the same concept where that kind of draws the skin and the muscles, increases blood flow, and that can be helpful to decrease the symptoms of pain and sometimes numbness at the bottoms of your feet. There's some taping techniques that we can do to facilitate muscles. And we always give you an exercise program. Remember I said exercise was really important, and that would include some aerobic exercise that would work for you with your symptoms, as well as specific strengthening of the muscles that we find that might be weak, and some balance activities to practice to keep those writing reflexes sharp. So we look at kind of the whole situation, what your symptoms are doing, how they're affecting your function, and then we kind of tailor treatment to those needs specifically when we work with people in physical therapy. But there's things that you can do at home. We talked about those a little bit right there. Some of those you can do at yourself. You can also do that in the community. So you might have yoga classes. There's music therapy is a thing. You might go see a massage therapist, but remember that you can do these too. It's not something you have to spend money on or go to, but you can practice these things at home as well. It's important to really take care of your feet and your hands, whatever is affected. So make sure that you're checking your skin over. When you can't feel everything, if you have some numbness, you may have actually an injury to the finger that you might not even noticed, and we don't want that to go unnoticed, so it doesn't heal or heals improperly or has risk of infection. It's very important to actually wear footwear, good footwear, of course, but even having something as a barrier between your skin and where you're walking, whether it's indoor or outdoor, can protect your feet from having those injuries. So same thing with the gloves. I notice when we work with cancer patients, there will be some people, even in the summer, when they come to their appointments, they have little gloves on, like the little stretch gloves, even from the dollar store, because the cold of the air conditioning can even make their fingers really hurt. And so just wearing some gloves, actually. People might look at you funny wearing gloves in the summer, but that's okay. Just ignore them. It might be easier to wear like elastic or Velcro strap shoes when you don't have all the feeling in your fingers, maybe to tie your shoes. Same with shirts without buttons, things like that. A couple other ways to be safe there at the bottom of the list. Using large handled utensils. And I said it's kind of hard maybe to hold a toothbrush or cut your meat or your food. Those are some things that you can actually get on Amazon. You can look it up. Silverware, adapters, you can think of whatever you might want to call it, something to make your silverware bigger, easier to hold on to. There's a lot of those things that are very easy to get a hold of to help with function. Please just be careful. Do use the railing. It's there for a reason. Be careful, especially with getting in and out of the bath or a shower. It can be very slippery. There's some easy grab bars that you can actually buy at most pharmacies, CVS, Walgreens, Meijer, that suction right onto the wall or a tub that you have a hand rail to kind of hold as you're getting out. You may need a cane. I talked about that. We may suggest if a cane or some other device, if you have trouble with balance. Not always do we want to use that, but if that keeps safe and able to continue with your daily activities, it's nice to be able to do that. So it can be a major problem. It could really be a bummer. Sometimes I think this is kind of a downer topic because it's not fun. It doesn't feel good and we don't know if it's going to go away. But there are some things that can be done. And I hope you realize that we're here around to help you if you need. I can't emphasize communicate enough so that we know how to help you or what might be a best resource for you. Your medical team might know how to change things to help manage the symptoms. But things like acupuncture, physical therapy, dietitians are out there to help as well. So communicate, communicate, communicate. Keep yourself safe. Do the things that you can do at home. Keep doing this too. The support groups, educate yourself. The more you know, the more you can help yourself. Knowledge is power. So I'm glad you guys tuned in today and hopefully you'll learn some tips that you can share with others or use for yourself.